The United Kingdom understood the need for a healthcare system that long before most of its counterparts. In 1948, the country established the National Health Service, what is known as the NHS. Now, the plan was to provide free health services to the entire population, but for decades the NHS has been in a state of crisis. The services are free, but they're not accessible. Now, this year, ahead of the elections, the Labour Party had promised an overhaul, and within 2 months, the Prime Minister is talking about that change. Keir Starmer has said that the NHS needs major reforms and not more funding.
Once we know how we're going to fix it, that is when we start thinking how long would it take to fix it. My guess will be somewhere around 5 years up to 8 years to get the NHS back on its feet, based on the previous work, as you remember, around the millennium when the NHS plan came out in 2002.
The government has said that it is working on a 10-year plan to fix the health service. Not much is known about the plan, though. What we do know is that there will be focus on 3 things. Firstly, using more technology to create a digital NHS. Second, shift more care units of hospitals and into communities. And thirdly, move from treating sickness to focusing on prevention. The latest row was sparked by an independent report on the system. It is by R.R. Darzi, a surgeon who sits in the House of Lords. The NHS has been in a state of complete crisis. The COVID-19 pandemic had a grave impact. Private hospitals were drafted in to help with the pressure. The United Kingdom is still feeling its impact. Prime Minister Starmer was quick to blame the previous government, though.
The last government broke the NHS. Until this morning, we didn't know the full scale of the damage, which is laid bare in the report. Even Lord Darzi, with all his years of experience, is shocked by what is discovered. It is unforgivable, and people have every right to be angry.
We earlier spoke with Mr. Mike Buckley, a senior journalist and a political commentator. Listening to what he had to say.
He's talking about a reform to the way that the NHS works. There's been a number of, things that have damaged the NHS in the last 10 years. So there was a big reform in 2012, a huge reorganisation from the last government. They were warned when they did it that it would lead to disaster in the NHS because it was a big reorganisation. They moved lots of departments around, lots of staff around, lots of money around. So then, of course, you've got lots of people spending time moving departments, changing what they're doing, reporting into different people rather than helping people and doing the jobs that they were doing to take care of the nation. It's also made communication between different departments much more complicated. So the damage that did was partly undone by the last government, but that needs to be completely undone, or something new needs to be put in its place. And it's also the case there's lots of time and energy and effort going into the health service in ways that don't produce the health outcomes that we want. So, for example, we don't do enough in terms of health prevention, or sickness prevention rather, so disease prevention, so we need to do that. There's a lot of time and energy that's involved in booking beds for people. We don't have enough beds per capita. We have far fewer hospital beds per person than lots of comparable nations, so we do need to build some new infrastructure.
For all the latest news, download the WION app and subscribe to our YouTube channel.